Hello, and we are back with Center Radio or Webcast, episode 21. We have from the CGC, the Community Guidance Center, the CEO, Dr. Ralph May. Hello, Dr. May. Are you there?
I am.
Great. How are you today?
Officer, not the CEO, so I don't want to make my boss angry either. So,
I'm sorry.
I'm the next boss down, so one boss right above me.
Okay. So you are with the Community Guidance Center. Can you tell us a little bit about the Community Guidance Center for people in Indiana that may not know? I guess most of us know about it, but for those that outside the listening area that may not know about the Community Guidance Center.
Yeah, the Community Guidance Center is a community mental health center. We have been in existence for 61 years. We have a large presence in the Indiana community, but we also have a presence in Punxsutawney and Clearfield and Jefferson County, in Clarion County, and even a small presence in Cambria County. We have offices in six offices in different locations. At being a community mental health center, we serve the mental health needs of the entire age range. We see all age ranges, all mental health type of issues. Depression, anxiety, even schizophrenia, bipolar disorder. We work cooperatively with the Open Door in town, which is the Drug and Alcohol Agency, to work with people who are struggling with both addiction recovery and mental health recovery. We have about 2,800 people who are in our services at any given point in time. And we bring in about 120 to 130 people per month into mental health services here in Indiana County. And we're very fortunate that we have a walk-in intake system, on-demand services, where people can call, come in, and be seen. And with the COVID epidemic, we've actually been fortunate that we can do everything online. We can do the evaluations for people, we can do therapy, we can do medication evaluations, psychiatric services, all online. Confidential, of course, encrypted using a Zoom platform that's encrypted. We can do that with privacy protected. And we found that many people are really able to access our services now much more quickly than they were, because the state and our licensing and insurers are agreeing to allow telephone and Zoom and remote, because many of our people are poor and they're very rural, and transportation to our offices can be a challenge. And so with this platform, we can now help people get the services they need at a much more convenient and accessible manner. So the COVID crisis has led to some innovation and development, which hopefully will be able to be sustained after this is passed. So.
That is wonderful to hear as far as, your outreach here in the community. I just found out, though, that that the CGC is now a certified or licensed trauma-based facility. Can you share a little bit about the philosophy of what trauma-informed mental health care is and what that practice looks like?
We were certified through the Andrus Institute in the Sanctuary System, which is a nationally standardized trauma-informed care systems transformation initiative. So we went through a 5-year intensive training with trainers from Andrus, from Sanctuary, where you train from your board president to your janitor in trauma-informed sensitivity. Sanctuary and trauma-informed care simply means, and I think for me this is the powerful statement, when someone calls us, the first question isn't, what's wrong with you? The first question is, what happened to you? It changes your whole mindset in terms of engaging someone. And we know from the psychological literature, not only locally and nationally, that 70 to 75% of individuals who come in with mental health needs have trauma in their background. That doesn't necessarily have to be physical abuse, sexual abuse. It can be poverty, it can be discrimination, it can be stigma, but the concept being that the person feels put upon, abused, looked down upon, devalued. And so when an individual is coming in for services, they're coming in a one-down position where they feel like they're going to be not understood and not heard. So what Sanctuary does is it sets up a conversation so that we are welcoming you in, knowing that you've been hurt, knowing that you do not feel respected. And our primary goal is to help you feel welcomed and respected as we engage you in the service of recovery.
So on those lines, with sanctuary and the understanding of the trauma that people are going through, like right now, the outbreak of COVID-19 has, people feeling very overwhelmed. They have fear and anxiety about the disease, also about, working, being laid off of work, food,
Right.
bills, and things like that, what's going to happen in the future. What advice can you offer the general public about what to do if they begin to or they're feeling anxious about COVID-19, and how do we balance that need to become educated about what's happening with being inundated with too much information?
I think that's a great question. And I've been really pushing the point of not overwhelming yourself with watching every news feed, every email, I mean, you can become inundated with all kinds of information. You become so overwhelmed that you can't process anything. You just become immobilized. You don't know what to believe. You don't know who to believe. You don't know what's real and what's not. So you become very immobilized. So what I encourage is to limit your exposure to information about COVID. Stick to the main sources, the CDC, the Pennsylvania Department of Health, and make sure that you only focus on that a limited amount per day to stay informed. Then you need to do fun things, watch funny things, view funny things, get active, get outside while you can safely. Make sure you're taking care of yourself, you're eating appropriately, you're socializing using platforms that allow you to stay connected. So even though you may be socially distant, you're not socially isolated. As a psychologist, I'm very concerned about the impacts of social isolation. Prolonged social isolation can have very detrimental impacts on the psyche. And so when a person is prolonged isolated, they start to become very suspicious of the outside world. They start to become more depressed. And so getting out of that can become a challenge. What you're seeing nationally is this polarity. People are like, I want to go back to normal. I don't care about the virus. I'm just going to go out and live like I always lived before. And then you have other people that are paralyzed with fear. They're afraid to engage because they think they're going to get sick. I like to distinguish fear from anxiety. Fear is a realistic reaction to something that is a truly an honest threat. Fear has to be understood. You have to understand what you're really afraid of. What are the risks to you? Don't go out and play in traffic. That you should be afraid of that. You can be hurt really badly. But COVID, if you're taking precautions, if you're washing your hands, if you're masking, if you're maintaining appropriate social distancing, you should be fine as long as you don't take excessive risks. But you have to be respectful of the virus, which means you have to understand that there's a risk here. You can't just ignore the situation. So we're encouraging people to not be afraid to begin to come out of the isolation, but to do it prudently, to do it carefully, to do it respectfully. Also, I think it's important to remember that it's truly an unselfish act that when you're coming out, you're cautious. You're protecting other people as much as you're protecting yourself, because you can transmit the virus and not even be sick. So you have to be respectful of others. You have to remember that this is about social responsibility, that we don't want to hurt other people, even though we want to be free of this. And by the way, I hate that new normal. I think that's ridiculous. We want to be normal. We want to go back to normal. We don't want it to be the old normal, the new normal. We want to just go back to normal. We can get back to normal, but we just have to get back to normal slowly and carefully and prudently, watching out for each other.
Wonderful. Those are wise, very wise words, and thank you for that. I think we had another guest on before that talked about social distancing versus social isolation, and how it can affect humans differently, but depending on what situation you're in. Along those lines, physicians and other frontline healthcare professionals are particularly vulnerable to negative mental health effects, as
Yes.
they strive to balance the duty of caring for patients with concerns about their own well-being and their
Yes.
family and friends. I have family members that, they have a routine. They come in, they, have to strip off their clothes and, go up and take showers before they can play with their kids. Can you just talk a little bit, or, what advice might you give, care workers or frontline workers that are out there with, working with the public every day?
I'm glad you asked that question. I'm the clinical director of the Indiana County Critical Incident Stress Management Team, which we respond to the first responders.
Oh, nice.
when they reach points of being overwhelmed. I mean, they respond to stress normally that we would be very overwhelmed by, that they do as part of their regular work. But there are always events that can be very, very hard on first responders. I'm very concerned about our medical personnel and our individuals that are working with COVID, because they've been asked to perform, incredible duties with long hours and not much protection. I was listening to some of the stories out of New York. We lost one physician, was high-profile physician who died by suicide, who had COVID, came back. The issue here is, my advice is, remember, you're doing a very important job. This is a job that only you can really do, and it's very, very valuable. But you have to remember you're a human being. You have to remember that you have feelings, you have limits, you have things that you're going to need to decompress. You're going to need that space and time to decompress. I'm particularly concerned about those healthcare workers who had to stay with COVID patients who were dying, who couldn't be with their families. And so they had to be basically the bridge between the family and the dying patient, and be the witness to that process. And the worst thing you can do to a healthcare worker or a first responder is put them somewhere and make them feel helpless. Make them feel they can't help. The only thing they can do is watch. That's one of the most difficult traumas that you can do to a frontline first responder. And so when we pass, they will not do much now. I will tell you right now, when the job needs to be done, they're going to be decompressing, going back, decompressing, going back. They're like combat. They do not want to leave their unit. They do not want to leave their friends. But when this does pass, they're going to take a breath, and that's when the impact is going to be felt. They're first going to be wanted with their families. They're going to want to go back to normal. And a couple of months after that, they're going to start having probably flashbacks, nightmares, intrusive recollections, emotions. And so I'm very, very concerned about making sure we monitor the mental health of our first responders, not just now, because now they're going to be like, I don't want to hear about that. I need to take care of people. I need to do what I need to do. But when the wave passes, they are going to need monitoring and attention. So my counsel to everyone who loves a first responder, who is a first responder, is that you're going to want to get back to normal, which is great, but you may have some echoes. There are going to be echoes that you're going to have to pay attention to, so they do not dig them right into you and stick with you and start creating problems. We don't want to have people have PTSD. We don't want them to have post-traumatic stress. And the antidote to that is, don't bottle it up, don't stuff it inside, don't pretend like this didn't happen, but get the assistance you need and the support you need to be sure that you're not carrying it.
So with children, how do you talk to them differently than you would about like frontline workers? Our children have been inside the house and locked away for 2 months, haven't been able to get out with their friends and socialize. What is your advice to them? How are your counselors there dealing with children that may be having some crisis issues because of the transition that they've had in the last 2 months?
Children, you have to look at the developmental level. Very young children will very much gear on the parent, caretaker, or adult's emotional state. So if you're calm, if you're able to explain, not over-explain, right? You let them ask the questions. You let them talk to you. And you tell them, well, this is a sickness. People can get it like the flu, so we've got to do these things to take care of the germs. And there's some great stuff from the Substance Abuse and Mental Health Services Administration on teaching kids about COVID, talking to kids about COVID. There's a lot of handouts out there about how to developmentally tailor the conversations to the child. So you don't want to inundate them with too much information, but you want to make a story or a narrative about this that gives them a sense of control and reassurance. Children are looking for a sense that it's going to be okay, particularly you're going to be okay. The people they know, they love, and care about are going to be okay. So you're going to make things as normal and as routine as possible, even though things are different. You're going to set up rituals for them and structures for them where you spend time together, and you're going to make it as normal as you can until we get back to normal. With adolescents, they tend to be a bit more challenging. They want to know why. They want more explanation. They have more energy and sense of righteousness in it. So the conversations can be more about the process, the challenges that we face in the world, the unfairness sometimes of these things that we have to face. So those conversations become much more tailored for the older adult. So I want to point out that most of us will come through this and be okay. But some of us already have pre-existing anxiety, depression, bipolar disorder, addiction, and this is not going to go easy on somebody that's already got an emotional burden. They may get through the acute phases of it okay, but then they're going to have a burden, a cumulative burden, when this is done. So with our people that are under our care, we're encouraging them to engage in good self-care, to maintain their therapy sessions, to maintain their medication. I've seen some of our people that it's sad because the routine is disrupted and they stop their medication, they become very ill. And then they have to go into the hospital. And we really want to try to help people avoid that if they can, to stay in the community and stay in their homes as much as possible. So the idea being, there's no one size fits all. What you have to do is listen to the child or the person that's raising the concerns, invite them to questions, but take care of yourself and make sure that you're calm, you're feeling good about things. That's very, very important.
Thank you so much. You've been such a great help. So many words of wisdom, a grateful insight, a lot of insight into the mental health issues that we're having right now. If anyone needs to seek help or treatment for themselves or their loved ones, how can they get in touch with this with the CGC or a hotline there, or any information you might have about how they can reach out?
There are two main numbers. There's the main Community Guidance Center number, which is 724-465-5576. That's our main number. You can call it 24/7 and somebody will answer. And then we have the Indiana County Crisis number, which is 1-877-333-2470. You call either one of those numbers, there is a person 24/7, a therapist, that is available to talk with you. You don't have to give any personal information if you don't want. You can just, say I need to talk. You can be calling for yourself, you could be calling for someone, but the bottom line is there's always accessible mental health care in Indiana County, no matter what day of the week, no matter what month of the year, no matter what time of the day.
Thank you so much. You've been a pleasure to have on. Like I said, great insight into the mental health issues that a lot of people are experiencing right now. Thank you so much.
You are welcome. I appreciate the opportunity.
Thank you.